Welcome everyone to our video. My name is Rich Lenkov. I'm an attorney with Bryce Downey Lenkov. I head up the workers' compensation practice, and we're coming to you today with an update on the coronavirus and specifically how you handle a claim from an employee that they developed this virus as a result of work. We're very privileged to have one of the foremost experts anywhere on this issue, Dr. John Koehler. Dr. Koehler practices occupational medicine. He actually founded Physicians Immediate Care in 1987, and he is currently medical director for occupational medicine for Physicians Immediate Care. He is board certified in occupational medicine, and he practices in Illinois and Wisconsin. Dr. Koehler, I know you've been all over this issue since January, so I know you're very busy. We're really lucky to have you today. Thanks for joining us.
Glad to be here.
So we also want to acknowledge Anna Rollins from Integrity. Integrity is a MedLogix company and the industry leader for independent medical exams and medical file reviews. They provide their services nationwide. I could personally say, having used Anna and her company extensively, that they have been a tremendous resource to my firm. So we want to thank Anna Rollins for supporting this presentation today and bringing to you the latest updates. So really quickly, we're going to give you a quick overview. We've got a few minutes to talk to you. We know you're being inundated with information, so we want to really focus in today on the legal and medical perspective. So from a legal perspective, as you'll also read from the article that's attached, we recommend that you defend a coronavirus claim in 4 different ways. And they're really not that different from the way you would handle any other alleged work-related claim. The 4 things that we want you to focus in on are, number 1, the diagnosis. Obviously, the first thing that you want to look at is whether your claimant actually has coronavirus. Because as you know, and as the doctor will tell you, the symptoms that are associated with this virus are similar to that in some ways that you can find with other conditions like the common cold or allergies or influenza. So before you decide whether you're going to accept or deny it, make sure that you have the proper diagnosis. Number 2, and this is probably the biggest area that we'll see litigation on, is accident, right? Accident is a legal question. The legal question that comes into play with coronavirus is obviously whether your claimant developed this condition, caught the virus arising out of and in the course of their employment. Again, same analysis you would apply to any other condition. And as always, it's the claimant's burden to prove. So this will be very difficult. The very nature of coronavirus, as you know, is that it's so contagious. It's spreading like wildfire, and you can catch it in a variety of places, a variety of ways, through just incidental, touching and interaction with other people. By that very nature, then, it will be difficult for a claimant to show that they developed this condition because of exposure at work versus anywhere else in the world. Now, we expect that this will be an easier burden to meet if you're in a high exposure field, a high exposure occupation. You work for a nursing home, you work for an airline, a cruise ship, you're in the healthcare industry. Obviously, those will expose you to a greater degree than other occupations. But even in those situations, it's still claimant's burden to prove that they caught this particular condition from work. Now, we think practically, will an arbitrator in any state you're in be more sympathetic to someone who alleges coronavirus from working in a nursing home? Of course. But legally, keep in mind that we still think this will be a difficult burden to overcome. Number 3 issue is causation. Once a claimant has proven accident, the next burden is causation, and that is a medical question. That issue is whether the claimant can prove that their current condition was caused by the exposure to this virus at work. Now, practically, I think if you prove the accident element, you're probably going to be able to prove causation. But remember, like in any claim, those are 2 separate and distinct areas. And just because you prove accident doesn't mean that you prove causation. Causation is usually something that you need a doctor to testify on behalf of the claimant as a treater, and only if you have that opinion do you need to fight it. If you don't have a causation opinion, I think you could safely deny that claim. The fourth and final issue that I want you to hone in on when you have a coronavirus claim, and we know there will be, as quickly as the virus is spreading, as quickly will there be litigation. That's sort of a golden rule of what we do. The fourth issue is permanency. What, if any, permanent partial impairment will result from this condition? As we are hearing, the symptoms are usually lasting about 14 days, but that's not always the case. So certainly, while someone has compensable coronavirus during the time that they're exhibiting symptoms, if it's related, pay them their TTD, pay them their medical. The question then becomes, what is the permanency? I think that based on what we see now, the permanency is very little, but as a doctor will tell you, he's the expert, there might very well be some permanent impairment, some disability resulting from this condition. The final thing on permanency is obviously if this condition is fatal, obviously if you've got a claimant's dependents who are alleging that their father, son, whatever, got coronavirus from work, then death benefits may be owed in whatever state you're in. There's usually a provision for death benefits in Illinois and Indiana, generally 2/3 of your salary plus death benefits. But with that said, I will turn you over to the doctor, then I'll have some closing words in a few minutes. Dr. Koehler, take it away.
Okay, thanks, Rich. I'm going to discuss, I've been asked these questions, so this is not new. I've been on the phone an awful lot, as you might imagine. So can an expert determine cause and connection? So early on, yes, because early on you'll have situations where there's a work site or work environment where there's close proximity among coworkers. And if one of those workers calls up and says, I was just diagnosed with COVID-19, then you would then notify those who were in proximity with that individual and then determine if there was direct contact for high-risk exposure. They might need to go home for a 14-day quarantine. But it's obvious that if one of those individuals who had direct contact with the COVID-diagnosed patient come down with COVID-19 infection within the next few days, be it anywhere from 1 to 14 days, because the maximum time period of asymptomatic incubation is up to 14 days. If they come down with it during that time period, they would have a strong claim that there was a causal connection because of their exposure to the COVID-19 positive patient in their workspace for which they had contact, be it in a meeting, strategy session, cubicles close by, conversation in the break room, etc. So early on, you'll be able to trace those and have a better handle on causation early on because it's not ubiquitous in our environment as yet. Come late April, May, April and May are going to be the most advantageous climatic conditions for community-wide spread. So we're going to have the actions taken now hopefully will blunt the influx of patients during April and May, but that's going to be the peak, at least in Chicago. So there will be a basis for causal connection early on when you can trace the cases much more objectively. And obviously, once the staff is at home, isn't working, they're working at home, you can't create a causal connection with work when they're at home because you could say they went shopping, they went to get their nails done, they went to the gym, gyms are closed, or wherever they might have gone over to a birthday party somewhere. So early on, yes. Later, when it's a ubiquitous, not so much. But by then, it might be irrelevant if they're working from home. So that is the issue. Then the symptoms. You've all heard fever, cough, sore throat, kind of like the triad. I would like to add for you today, very importantly, profound weakness. This is how you can tell the difference as much as you can between influenza and COVID-19. Profound weakness. Also, there's been GI complaints, stomach cramps, diarrhea, GI. So be on your guard. If you have fever, cough, sore throat, plus profound weakness, GI issues, that's very strong, a very strong indication. We've all heard about the foreign travel issues and those kind of things. I'm assuming you're not doing any foreign travel, and that's going to drift away as being a relevant factor. So those symptoms will last. The person that does have COVID-19, they're ill for 14 days roughly. So roughly that. But there's others, if they're in the ICU, they could be there for a month in the ICU and have another month recuperating at home. So the variability is significant. There's 80%, probably 80% of the patients who have COVID-19 in our society will have a routine cold. They'll only have the cough, the sore throat, the fever transiently 3 days, and they're over it. And they're going to be tens of thousands of patients never tested. They'll say, I probably had it. I don't know. I feel good now. I had a cold. Maybe that was COVID. Maybe it wasn't. That is going to happen. But what we're trying to help are the people that have high risk, cardiac, hypertension, obesity, chronic obstructive pulmonary disease, chronic smokers, folks with immunosuppressant medication. Those are the ones that all of us are quarantined. We're trying to quarantine and limit. We're doing the social distancing to help the high-risk people, because this is lethal for high-risk people. Mortality rate, 14.6 over the age of 80. If you're over the age of 60 and you have obesity, hypertension, lung problem, it's probably 15% mortality potentially in those groups, in those isolated groups. Overall mortality right now is like 2% maybe. United States could be actually less than that. I calculated it. It is right now less than 2% in America. That's great. That's a testimony to great healthcare. So the last thing is that will there be permanency with this? Answer, yes. In some individuals with that patchy infiltrates that they have, that pneumonia, that viral pneumonia, can actually leave you with post-infection fibrosis, which then is detectable on pulmonary function testing, spirometry testing, that if there's a deficit after that, and that's going to be a lot of debate, like what was pre and what was post, because you don't have a baseline. You didn't get baseline spirometry at everybody, as you shouldn't. But for those industries that do baselines, because if they have silica, asbestos, et cetera, they will have baseline. So differential baseline will help to prove that. But for the rank and file people, obviously a desk worker who has no smoking history, who has a 20% reduction, then, or I should say an abnormal pulmonary function test, there will be debate about that, but that will be an issue that will probably be real. But again, it has to have causation to even have that relevant. See what I'm saying? So I would say by the end of mid to the end of April of this year, causation is going to be extremely hard to detect or to assess because of the ubiquitous nature of what it's going to be, as in everywhere. Did you get it from Walmart? Did you get it down the street? Did you get it from someone visitor came over, one of your relatives came to visit, a million other different things. So you could end up with, they talked about 20% reduction in pulmonary function testing, spirometry. You don't know the baseline, but if it's strongly abnormal and they have fibrotic lungs on x-ray or lung findings and auscultatory findings, and certainly you could compare the auscultatory findings during the IME with the auscultatory findings in the hospital. That would definitely help on that issue to correlate the physical findings or persisting that were in the hospital are now they're present during the IME. That would support that. So that's kind of the overview that I have for today.
Doctor, that's really fascinating, amazing information and stuff I think we haven't heard, especially as it relates to the legal and workers' compensation aspects. So we really thank you very much for your valuable information and your time today. How can our listeners or our watchers get a hold of you if they do want to retain your services on this issue?
My cell phone number is 815-415-1234. That's 815-415-1234. Email is jkoehler984@gmail.com.
Thank you. We'll certainly put that information on this recording. We will also put the information again for Integrity and Anna Rollins, because without their valuable assistance, we wouldn't be able to get you this information this quickly. Again, Integrity does great work in this field and in IMEs in general. Stay tuned. We, as a law firm, Bryce Downey Lenkov, will continue to keep you informed on the legal issues as they develop. We want to remind you that we're also available at any time for questions, bdlfirm.com. We are working, even though I'm working from home today, as you all are, we continue to work and serve our clients and are available to you. Again, Dr. Koehler, thank you so much for your assistance, and we will talk to you soon.
Take care.
All right, stay safe, everyone.